Hi, my name is Jillian, and I'm a registered nurse here at the Aesthetic Academy. What brings you in today?
Hi, Jillian. So I noticed I have some small fine lines around my eyes when I smile. I think just like also most notably like my forehead lines probably just acquired over some time.
Okay. Have you ever had Botox done before?
No.
Oh, first time.
Yeah.
Okay. Have you ever had filler done?
No.
Okay. Is it okay before we move forward if I just ask you some general questions?
Yeah, of course.
Okay. So you said no Botox, no filler. Recently, have you had any cosmetic procedures done or any dental work or anything like
No.
that? No. Okay. And then as far as your medical history, do you have any known autoimmune disorders or any history of excessive bruising or bleeding?
No, not that I know of.
Okay. Do you have any allergies?
No.
Great. Do you take any medications or supplements at home?
Nope.
Amazing. What are your expectations for today's visit?
So I have an event coming up, which kind of prompted this visit. I think ultimately I would just like to look more rejuvenated, more refreshed.
Okay.
Definitely maintain like a natural appearance.
Yeah.
So I'm hoping you can help me with that.
Yeah, perfect. So here at the Aesthetic Academy, we have the same goal in mind. We really do want our patients to really have that natural glow and that natural look when we're done. So I definitely think that we can help you achieve that today.
Amazing.
So I'm just going to give you a quick background on myself. I've been working here at the Aesthetic Academy for about a year now, and I have received specialized training in injectable procedures like Botox and filler, as well as other treatments like laser and microneedling. And here at the Aesthetic Academy, we really do take great pride in delivering high quality and safe treatments. Specifically, Botox is a favorite of mine, and I really, really love guiding first timers through this process like you. So I think that you'll be in great hands today.
Thank you. Yeah, that makes me feel super reassured.
Good, I'm glad. Do you have any other concerns before we get started?
Yeah, so like while we're on the topic, I do notice I also have some smile lines. I'm a pretty expressive person, so I guess that's just what happens.
Yeah.
But what do you think about that? Like, what are some treatment options?
Okay, well, first, if it's okay with you, I would love to just give you a brief overview of the aging process in general.
Sure.
Then I could do a quick assessment and I can let you know what I see. We can think of some methods, and then from there we can get started in your Botox today.
Great.
Okay, so as we know, when we're younger, we have nice definition, nice bone definition, we have tight skin, we have nice full cheeks, and as we age, we do see a change in these three elements. So we'll start to see a change in that bone definition. Sometimes we'll lose fat and volume in our cheeks, and that could weigh down on tissue, creating kind of a sagging appearance. And we also notice change in our skin integrity as we lose what we call collagen and elastin, which then leads to those fine lines and wrinkles that we begin to see.
Okay.
So what we like to do here is we like to reverse the aging process as best as we can. And fortunately, we do have treatment options for that so that we can continue to have that youthful appearance that we love.
Okay, amazing.
Yeah, so looking at you now, you are a beautiful young girl. You have these big, beautiful eyes. I do see how, years of smiling could create some extended lines around your eyes, and I definitely think that we can soften those today. You also mentioned your forehead, and I agree that I think that we can target both of these areas and give you a nice, refreshed look. Something else that we can do is you have a great roundness to your face, and you do have great bone definition, great bone structure. What we can do is we can add a little bit of a lift here to your mid-outer face, and that could really help settle those smile lines that you mentioned. So the way that we do that is we can use filler, or we can use laser treatments, and that will really help promote your skin integrity.
Okay.
So what we want to avoid to do is really do anything to the smile lines directly. So that will really just help us create the natural look that we both want to achieve.
Okay, makes sense.
Yeah, so we really like to target the aging process as it happens, and then hope to reverse it just to maintain the natural youthful look that we love.
Yeah, that makes total sense.
Okay. Do you want to get started on talking about products today?
Yeah, of course.
Okay, so Botox is a neurotoxin, and what it does, it blocks the release of acetylcholine from the neuromuscular junction that temporarily paralyzes targeted muscles.
Okay.
So the FDA does indicate about 64 units for this upper area of the face. Since it's your first time today, I don't think that we need to do 64 units of Botox. I think that we can do something less, about 40 units. That'll kick in about 2 weeks, but you'll start to notice change within the first week, around like 3 to 5 days. It'll last for 3 to 4 months. but it also depends on the amount of product we use. So in the future, if you feel like you want a longer lasting result, just let me know and we can add more.
Okay.
Yeah. So some things just to look out for with Botox, some risk are you can have a droopy eyebrow, or you can have a droopy eyelid, or you could have an unnatural arching of your brows. If anything like that happens, just come in and let me know, and we can either use correction injections to fix it, or sometimes you just need to wait it out. It could be like within that first 2 weeks, and you just have to wait for the 2-week mark to kind of let it fully kick in.
Sure.
But if you're unhappy with your results, please let me know. You can come on in, and I'll definitely be reaching out to you in 2 weeks just to see how you're liking everything.
Okay, awesome.
Yeah. And then, so as far as your smile lines, that could be something that we do today. Or if you'd like, you can make an appointment and we can do that at a future date. So either, no problem with me. But what I was thinking that we use is a product called Voluma, and that's part of the Juvederm family, and it's a thicker hyaluronic acid.
Okay.
So it's firm, and it'll create the good structural support that we're looking for. So Voluma is known to have high cohesivity and as well as high viscosity, and that will help create the defined lift that we like while also creating a very natural look. So what we'll do is we'll have to inject for that. So we'll do 2 injections on the cheeks here, and we'll do about 1 milliliter per side, or 1 syringe. And those results, they last between 18 months to 2 years.
Wow.
So it lasts like a lot longer than Botox will. Of course, over time, it will start to dissolve. So if you love the look, at around a year or a year and a half, you can come back for more if you'd like.
Okay.
So something to look out for filler is, well, you'll expect some bruising. That's normal, and some tenderness when you leave.
Okay.
But if you do have any changes in your skin color or any severe pain, that is something that I want you to come in immediately. Our concern there would be something called a vascular occlusion, which is if hyaluronic acid enters the blood vessel or compresses on it, and it could lead to tissue death or something we call necrosis.
Oh, okay.
Yeah, so that would be more of a medical concern. It's very rare. I don't want it to be something that you're worried about. But if it does happen, please come in right away.
Okay. Gotcha.
So, yeah, do you have any other further questions for today?
So with the Botox, what do you think are some like immediate side effects I might experience if I get that done today?
Okay. Honestly, you might have a little bit of redness just because we are injecting with needles. That is completely normal, but they should fade pretty quickly. The area might be a little tender as well, but a lot of my patients who come in, they'll go to work after and just go on with their day or go back to school, so it shouldn't be anything to be too worried about.
Oh, great. So it's like super low maintenance.
Yes, pretty low maintenance, exactly.
Awesome.
Yeah. All right, did you want to do the filler for the smile lines today, or
well,
just your
yeah.
Botox?
So like since it's my first time, I think let's take it step by step. I think the 40 units sounds super approachable for today. We'll see how I tolerate it, see what the results look like, and I think we'll kind of like I said, take it step by step and maybe do the filler in a future appointment.
Yeah, absolutely. That sounds great. All right, so let's get started on your Botox today.
Yeah, great. Amazing. Thank you.
Okay. Yeah, you're welcome.